Hi everyone, and welcome back to the Āyurvedic Academy YouTube channel. We are here today talking with Katerina Nestorovska, who lives in Melbourne, Australia, and has become Āyurvedic Academy's very first SA to practice in the collaborative fashion, in the collaborative team on myÄyu online. Katerina graduated SA 2021, and so that was June, July 2021, and since then has been practicing with me online, working with over 20 clients in myÄyu. Katerina, welcome.
Thank you.
Thanks for joining me here to get this message out to people. It has been a challenge. As you know, we've been running the SA program for 5 years now. This is the 5th year, and out of all these 5 years, I want to congratulate you to say that you were the first one to finally make it and start practicing with folks in the way that SAs have been trained to work with people. How does it feel?
It feels great. Thank you for allowing this opportunity as well. But it's really nice to be able to get to the other end and working this way finally, and work in this collaborative way with myÄyu clients, and to also see how the SA program has really helped build myÄyu and has helped us to very slowly over the course of time. I think we've been doing it now for close to 1 year, get to the point that we've gotten to.
Exactly. And thanks for staying committed and staying with it and helping it grow, because it definitely takes time. And it definitely takes a lot of work to get something like this up and running and presented in a way that people can understand what it is, because it is very complex, as we've spoken about many times. It's hard to explain what we do. It's hard to, even demonstrate. But really, the proof is in the results. And when people come in and they're feeling one way, and when they go out and they're better, we know something has been done well, something's been done right, and that's how people either keep coming back or they spread the word and more folks come. So it is a totally new, or kind of a new way of understanding how to practice Ayurveda, especially, and how to practice holistic healthcare. We'll talk more about that in a little bit, but I want to first let you kind of explain to the audience what your background is and what your story is. How did your journey with Ayurveda come to the point where it is today?
Yeah, sure. So my journey is, into Ayurveda came later on in life. I didn't start my education in Ayurveda. I have studied various different modalities over the years. I actually started in psychology and criminology and followed that path for quite some time, and forensic science. And then I came into the complementary health therapies world just due to family illnesses and just wanting to know other ways outside of allopathic medicine that we can help. And so the first place I landed was actually homeopathy, and that was my last degree before getting into Ayurveda, was a Bachelor of Homeopathy here in Melbourne. And whilst I was studying my homeopathic degree, alongside that, I was also qualifying as a yoga teacher as well. And so that naturally just kind of expanded my world in terms of the different ways in which we can treat outside of the Western medicine model. And I became interested in Ayurveda. And so I graduated from my homeopathic degree. I started to practice clinically here in Melbourne. I also started to teach yoga. And after several years, my interest in Ayurveda just kind of grew more and more and more. And I very naturally wanted to learn more. So I had planned a trip over to India to do a number of different things, to study a little bit more with yoga, and I did a little bit of classical music studies there as well. Nothing too serious. I'm definitely not a professional musician by all means, but it was just something that was sparking my curiosity. And whilst I was there, I did some studies in Ayurveda in Kerala. So I started just with 1 month, and I studied at a private international, I guess you would call it a school there. And it was a very intensive 1 month study. So it was Monday to Friday, 9 to 5, intensively studying. And then I came back the year after, and I did another 2 more months to complete that. And so when I got back to Australia, I found that it was just not quite enough. And so I was constantly looking for different ways in which I could expand my knowledge with guidance and with support, and, you know, with the appropriate and apt teachers. And I was on this search for a good, I would say 3 years before I came to Āyurveda Academy. And it was very, very difficult outside of India to find something. And even within India, really outside of the BAMS program, there's not really much there that can take you through the depths of Ayurveda and the complexities and just the huge ocean that it is.
Yes, great. And doing the SA program, how did that kind of meld or bring everything together that you had started, you know, pieced together or picked up along your journey?
Yeah, so I came to the SA program. I started in 2020, and then my year level graduated in middle of 2021. And at that point, I had not done any in-depth studies in Ayurveda for about 3 years. It was 2.5, 3 years, but I was in the search at that point because I knew that there was a lot more to study and a lot more to understand and skills to be gained. And so when I really kind of sunk my teeth into the SA program, it really showed, or it was such a good example for how much dedication is required in order to understand this modality of medicine.
Yes, it definitely is an ocean of knowledge, and even classical literature states the very same thing. And so trying to get to the point where one is established well enough with solid foundations to go into professional practice often takes multiple years and years of continuous regular study. As you already know, of course, the minimum level of education for Ayurveda in India is 5.5 years of full-time study. And so this by no means is anything like a weekend workshop or a series of weekend courses. And so even for the SA program being 1 year, we can really only expect students to be able to get so much in 1 year, and that too of deep, intensive study. And so it was great that you came with this background of searching for several years, of having gone to India, seen what it's like there, experienced different kinds of educational programs in different ways, because you knew what the shortcomings were and you knew what you needed to fill in terms of the gaps so that you could get to the level of practice that you ultimately wanted. So what does your current practice look like now?
Yeah, so now I am actually practicing 100% online as it stands, which is very different to how I was practicing before, which was an in-person type of model. And I am practicing pretty much solely through myÄyu. So all of my clients are coming through via myÄyu. And we're practicing in this integrative or collaborative way under guidance and mentorship with yourself. So my practice right now is, I would say, even though it looks very, very different, it's a lot more solid than it was previously. Yeah.
Great. Yeah, so it's a big shift. And I think in the last couple of years, with the whole COVID thing, a lot of people have realized that, hey, wait a minute, we've had this technology here available to us for 20 years. We've been doing with it. It's about time. And it's, to be honest, it could have come 20 years ago that this shift into the online space could have happened for healthcare. It's unfortunate that it took something like a global pandemic for people to finally be open to this, but it really creates so many more possibilities. Now, people at home can get care that they need that doesn't necessarily qualify them for going to the doctor's office. They may not have something as serious that they need to be under constant supervision from their doctor. And frankly, they're confused. They don't know what they should do. They don't know the basics about diet, about lifestyle, right? How to exercise and when, how to sleep when and how much. And all of these sort of very subtle pieces that in Ayurveda are actually very, very clear. And so when you're working, of course, with me in myÄyu, and I know very well how you do that and what your skills are, and that you are very, very good at what you do. But to share that with our audience and kind of let people know, what do you feel like you bring to the practice that helps people, change their orientation of understanding health and attaining that level of health that they're so desperately seeking?
Yeah, and I think just to flow on to what you were saying before about the this transition into the online world, it's because of COVID that we are really able to work in this way. I mean, it was always available beforehand, and I had tried to do some online practice beforehand, but I think COVID really changed and shifted things for many of us. The beauty of this is now we can reach so many more people because you're not restricted to just working someone that is within your own locale. And so this has really expanded the way in which we can work. But also, in addition to that, we're utilizing a lot of technology that is available to us because we're working online anyway. So we may as well utilize the technology that is available to benefit the client in terms of things like tracking their progress. And so this was always something that I think was very difficult before, because I would see clients, maybe once a month or something like that for a follow-up. And oftentimes in that 1 month gap, they forget quite a lot as to what's happened. And not only have possibly forgotten, but also they may be presenting with a particular ailment or a particular symptom, or something may have improved even. And we don't know what the causation of that improvement or that new symptom or the worsening of something may have been. And so one of the great things in working in this way is that we're able to extend some of the technology tools by way of tracking progress and education and recommendations and things like that, where our clients are also becoming a lot more technologically savvy. And I think COVID's really pushed everyone into learning how to utilize these tools if they didn't know beforehand. So in terms of coming to the question that you asked there about my skills and how I work in myÄyu with clients, it's one of the key things is really identifying the causation to why they are coming to see us in the first place. It's trying to get to the root cause to why they are feeling the way that they are feeling. Because were they feeling great, they wouldn't come to see us in the first place. So that's the first point of call for me, is to try to really go searching and looking for patterns. And, in some ways, I kind of joke about this sometimes with myself, thinking, oh, my forensic science background has finally come into play here, where I'm looking for patterns, but in a whole different way. So that's what I do, is I look at individuals' trackers, and where they have tracked their progress, they've tracked their daily regime, the food that the diet, their sleep schedule, all of those kinds of things. And I look for causation. And sometimes that causation is very obvious and it just sort of smacks you in the face. And other times it's very, very subtle, and you have to go and look at some very nuanced areas of that individual's life to find exactly what that causation is. So that's probably the biggest skill that I use, is to look for causation, to identify that causation. And then what comes from there is to teach the client. So it's education, teaching the client how to remove that causation, or at least start with reducing it as much as possible. And that is easier said than done, because we all like to hold on to our habits and those things that may feel comforting, but are not necessarily serving our body or our mind or the way in which we make our decisions. So the second part of my job is really about educating the client, whether that be through the physical body or the mental, emotional body, in how to know what that cause is, remove it, or at least reduce it, and look for the ways in which that the signs and the symptoms in which they can really track that progress. So they're the main skills. I use lots of different things, within my skills tool belt and how I go about doing this. But that's the main thing, is really just identifying the causation and then educating the client on how to remove or at least reduce it.
Wonderful. That is really such a broad skill, because then you can take that search for root cause and then apply it to all these different areas of life. You can apply it to their diet, their lifestyle, their sleep habits, their activity or exercise habits, anything else that might be a contributing factor. And this is one of the ways in which Ayurveda can be so complicated, because it really is, as we've seen the name translated, the science of life. It absolutely is the science of life, and it takes the complexities of human life and it puts them together in a framework. And it allows us to go searching for these root causes and then link across different areas of life to see how the whole picture fits together. And so at least, in my practice, and when we are practicing together, I think folks are able to get so much more out of it, because you and I have this wonderful sort of cohesive approach where you focus in on areas and you can really get to the details of diet, lifestyle, exercise, all of these other sort of daily activities. I can focus in on formulations, and then we can tie the whole thing together very nicely. So this collaborative approach, I think, is a strong way to help bring Ayurveda to a larger group of people who need help in so many different ways. And we can kind of, we're going through the sort of proof of concept stage at this point to show that it works, and we're getting good results, at least to back that up. So it's nice. And it's nice to be able to work together, because especially for SA students and for other students of Ayurveda, one of the biggest things I've heard from them is that they don't feel confident to practice, or they get to a certain point and they've done everything that they know how to do, and they're stuck. It's over at that point, and then the client leaves because they haven't been able to actually get to that next level or that next step. And thankfully, in our approach, we don't really come up to that type of problem. as much. And we make sure that ultimately the most important thing happens, which is the people who are working with us get the best result that they can hope for in the sort of the limitations that we experience in this online format. So it's very nice to hear how you explain what you do, because it is very complicated and you do a very good job of going through that. So thank you. I'd like to ask you one more question now and just try to understand, how do you feel like you are growing at this point, you know, as an Ayurvedic professional?
Well, the number one, I think you've just mentioned it a few moments ago, is I'm definitely more confident now. Whereas having come out of, you know, my previous short education in Ayurveda and just my search for finding some kind of supervision or mentorship or guidance, that whole journey there, I can definitely say that now I am much more confident because I have the foundations, which is really important. So that's one great improvement. I feel that I've had a very good education. And the way in which I came through this education is also a funny story in itself as well. And I think it's important to sort of mention this because it really separates the difference between, you know, just glossing over the surface and really going to the depths of the principles and learning them properly from the beginning. I was actually doing a short course, a short online course that I thought I would just, you know, do some things online when COVID first started coming through. And it was a good opportunity for me to take on some extra study. And one of the lecturers on that course really stood out. And she stood out because of the way in which she used the language, and her pronunciation and her explanation of the principles was very clear and crisp. And I just wanted to know more. I kind of was like, okay, I need to find out where this person studied, because this is what I have been looking for. And, you know, went and did some research, and of course found that she had was a previous graduate of the SA program at āyu Academy. And then, of course, I went looking there and contacted you, and the rest is history. Here I am on the other end. And so that that was the skill that I was looking for. What I heard in that lecturer's explanation and descriptions and teaching was the skill in itself. And it really was very obvious that this individual had received a very, very good education and knew her stuff. And that's what I was looking for. And I went looking for a long time for guidance and mentorship. And it was both in India and in Australia and online. And it's very, very hard to find ongoing mentorship. And I think that is really key, because with any medical practice, whether it be Western medicine or complementary medicine, there is always some sort of supervision afterwards, or some sort of mentorship or guidance afterwards. You kind of don't just come out of your schooling and you open up your shop front and you get going. There is an in-between, and that's really what I find is also missing, in addition to a lot of Ayurvedic education that is available out there, particularly in the Western world, is not up to standards, but then also there isn't the mentorship and the guidance afterwards either. So that combination between going through the SA program and now going through myÄyu in this way, where I am getting mentorship, I am getting guidance, I am getting supervision, has helped to boost that confidence. So that's definitely something that has improved. Skill is another. You know, having gone through the education process, you gain a lot of skill in that through that process. You understand the principles with a firmer foundation. You're able to now apply those principles with your clients. So I've gained a lot of skill just simply through the education process. And it's really taught me how to also do things according to protocol. Ayurveda very clearly defines in the classical literature on the protocols dependent on what we see in front of us. It gives the exact signs and symptoms, and it gives you the exact protocol on how to treat those signs and symptoms and manage them. And so one of the skills that was missing is how to sequence that and how to really identify that from the very beginning and follow that according to those key signs and symptoms and those key protocols. And then the other thing is, and this was hugely missing for me before, is I see quite a lot in outside of the BAMS Ayurveda world that there is a lot of prescription of formulations or single herbs, but I really wasn't confident in utilizing them as much because I felt like I didn't know them in depth enough. And so what I am observing now through this integrative way of working or collaborative way of working with a Āyurvedic Āchārya and then myself as the SA or Svastha Āchārya is that I'm able to observe not only the sequencing, but the application of the formulations under your guidance, for example. And so the learning has continued even after graduating from the SA program. Now what I'm seeing is all of the principles that I had learned through SA, I'm now connecting the dots with live patients, with live clients. I can see exactly the principles in front of me, and so many questions are now popping up, and I'm learning along the way. So I'm continuing to gain knowledge and build on the foundations that I learned from the SA program, and continuing to really build on that now through myÄyu.
That is so wonderful to hear. Thank you, Katerina, for explaining that very nicely, because I think there are hundreds, if not thousands, of other Ayurvedic students and graduates out there who have gone through programs outside of India and who are very likely in the same spot that you've been in. And it's not only frustrating for the students on an individual level, it's frustrating for the entire profession. And it certainly does not help the profession provide the kind of look that it could. It undermines a lot of what Ayurvedic medicine is, and it undermines a lot of what has been maintained for thousands of years as a very complex type of medical practice. And so I think that students not only, of course, get the benefit for themselves of learning the foundations, going through the rigorous training, being able to practice under mentorship, continuing to learn, because the SA program really is just opening the door to the depths of practice. But it helps uplift the entire profession as well, which is really the direction that we all need to think about how to move towards.
Absolutely.
Wonderful. Well, thank you so much, Katerina, for sharing your experience. And I would love to have probably another interview at some time and talk more about what do we actually do in myÄyu, right? How do we work with people? And for you especially, how do you go through this process of identifying root cause? And then how do you convey that to the myÄyu member so that they can integrate changes in a comfortable way that is accessible for them, because that is a huge skill as well.
Definitely. I'd love to chat more.
Wonderful. Thank you so much. All right. So that will wrap up our talk for today. Thanks everyone for listening. And if you enjoyed this interview, please go ahead and hit the like button, hit the subscribe button, and let us know what you want to hear more about in the comments. And we will do our best to get this information out to you as best as we can. All right. Thanks everybody. Bye.